Hi, my name is Ingrid Timpower, and I am a surgical nurse practitioner. It's my role to work closely with the orthopedic surgeons and touch on all aspects of your total joint replacement, sometimes seeing you before, during, and after surgery. When I assess you after surgery, if required, I may order tests, prescribe and change medications, as well as expedite your discharge. The purpose of this video is to prepare you for your upcoming total joint replacement surgery by familiarizing you with this process, team members, and how you can improve your outcomes.
Hi there, I'm Dr. Mehlay Kumanen, Chief of Family Medicine at the hospital and a family physician in Cambridge. As a primary care provider, I listen to your concerns, assess your pain and disability, and discuss referral to the Orthopedic Assessment Center for further evaluation of your symptoms.
The Orthopedic Assessment Clinic, otherwise known as the OAC, is a centralized and specialized clinic that assesses hip and knee osteoarthritis. The OAC provides timely access to an assessment by an advanced practice clinician or physiotherapist with specialized training in the area of hip and knee osteoarthritis.
Hi, I'm Connie, and I'm an advanced practice physiotherapist. Your visit with me will include an assessment, physical exam, and history. Based on the assessment, we'll make a plan together to manage your osteoarthritis. If I determine during your assessment that you would benefit from a surgery consult, I will make a referral to an orthopedic surgeon. This referral may be based on your surgeon of choice or may be based on the shortest wait time. I'll give you information regarding this process and send a letter to your orthopedic surgeon and to your family physician.
Hi, I'm Dr. Whitehead. I'm one of the 4 orthopedic surgeons that provides total joint arthroplasty here at Cambridge Memorial Hospital. When you get referred to one of our offices, we see you in our office and we have a discussion with you regarding total joint arthroplasty. We outline the risks, benefits, and complications of surgery, and if you decide to proceed with surgery, we sign your consent form as well as provide you with this educational booklet regarding your total joint replacement.
Hi, I'm Ruchi, and I'm the bundle care clerk. I will call you for your pre-op appointment, and during that phone call, that is when I will discuss any plan and preparation for your upcoming surgery. Basically, we're looking at certain equipment that you would need after the surgery, and most importantly, your physiotherapy. As a result of this funding model, the hospital has partnered with several physiotherapy clinics in and around the region. So if you choose to go to one of the clinics, your physiotherapy is covered. And if you forego this service, then you do have the choice to pay privately at the site of your choice.
Before your surgery, you will attend a pre-operative appointment with the nurse, pharmacist, and anesthesiologist. They will go over your medications, past medical history, and ensure it is safe to proceed with surgery. As part of the bundled care approach, the Ministry of Health also requires us to collect patient-reported outcome measures, otherwise known as PROMs. These are essential to understanding whether healthcare services and procedures make a difference to you and your quality of life, as well as letting us know where we can make improvements to our process. This is done through a standard survey, which you complete at 3 different checkpoints. These are before surgery, 3 to 5 months, and 1 year after surgery. At your pre-operative visit, you will be provided a tablet to complete the first survey prior to your surgery. You will be asked for your email address so that we can remind you to complete the survey at the other checkpoints from your home computer or cell phone.
Hello, I'm the pre-op clinic nurse. When you come in for your pre-op clinic appointment, we will go over your surgical history, health conditions, and current medications. We will advise you which medications may need to be changed for your procedure, along with advise you on any instructions for preparation for day of surgery. You may be scheduled for blood work, heart test, and/or x-ray. If needed, we will schedule you to see an internal medicine specialist.
I'm Dr. Laura Pupolo. When I see you in the pre-op clinic, we'll talk about your health and surgical history and make a plan for your anesthetic that suits your personal medical background. In preparation for your upcoming surgery, it's very helpful if you can cut down on your consumption of cigarettes and alcohol. In addition, you should avoid smoking marijuana for 48 hours in advance of your surgical date. Your primary care provider can help you with more information about smoking cessation or alcohol reduction if you need it in the preoperative period.
Today is your day of surgery. You will be registered and then directed to the surgical daycare, where the surgical daycare nurse will get you ready to go in for your procedure.
Hi, I'm Betty. I'm your OR nurse. I'm going to be taking you in shortly to the operating room where you're going to have your procedure done. There we will prep and position you as a surgical team. Also, we will be talking to you about the surgical timeout. This is where we talk about your surgery, make sure that we all are on the same page. And if you have any questions, this is the time to ask.
Hi, I'm Dr. Joyce Daly. I'm one of the orthopedic surgeons at Cambridge Memorial Hospital. On the day of the surgery, I will be performing the surgical portion along with an anesthetist who will manage your anesthetic. On the day of surgery, I will come out to see you. I will verify your name and your consent and ensure that we have identified the correct side, and then I will sign my signature on the correct joint prior to your surgery.
Hello, I'm Dr. Chen and I will be your anesthesiologist. On the day of your surgery, I review your anesthetic consult from pre-op and determine if any changes in your health has occurred since your last visit. I will also discuss with you the type of anesthetic you should have for your surgery. We'll make sure that you're safe and comfortable.
Hello, my name is Rachel. I am a registered nurse in the recovery room where you will come after your surgery is finished. In recovery, we keep a close eye on you, ensure that you recover from your anesthesia, monitor you for complications, and manage your pain. When you are ready, we will transfer you to the surgical floor.
Hi there, my name's Rob. I'm a nurse on the surgical inpatient unit. There, the nurses will check your vital signs, provide medications, IV therapy, and communicate with the entire team to ensure you're progressing in your recovery.
Hi, my name's Kathy and I'm the nurse practitioner for the acute pain service at Cambridge Memorial Hospital. It's my job to make sure that you get the right pain medication for you and for the type of surgery that you've had. We'll keep your pain within a manageable level, and if you have any side effects from the medication, we'll make sure that we take care of that for you too.
The day after your surgery will be full of activity. You will be visited by many members of the healthcare team, including but not limited to your surgeon, nurse, physio and occupational therapist, the acute pain service nurse practitioner, and myself.
Hi, it's Dr. Martin. I'm one of the orthopedic surgeons here at Cambridge Hospital. I'll see you a day after surgery just to make sure that you're feeling well and that you have a chance to ask all of your questions about the surgery itself.
Hi, my name's Sonia and I'm one of the occupational therapists that works on the surgical unit at Cambridge Hospital. I work with patients who've had hip replacements and I do an education session around teaching you how to move better, how to move within the precautions so that you can be comfortable and avoid problems with your hip. I also teach you how to do the basic everyday things that you need to do for yourself, keeping in mind those hip precautions, those movement precautions, and your comfort. So now we're going to put this into practice. So now our patient's sitting at the edge of the bed and you can see her hips are slightly less than 90 degrees. You always know when the hips are less than 90 degrees because the knee is slightly lower than the hip. If I put a marble on her leg, it'll roll downhill. So now we're going to review how to get dressed, the lower part of the body, keeping in mind the hip precautions, not to bend too much at the hips. So I'm going to give you the long-handled reacher. This is going to stop you from bending all the way. I'm going to give you the pajama bottoms. Always dress the operated leg first. You're going to grab it with the pants with the reacher. You're going to drop it down. You're going to let go with this hand and you're going to thread it over your feet right up. When you get to the knees, use your hands to pull up because hands are always better than equipment. So now we're going to learn how to put on socks. I'm going to give you the sock aid and I'm going to give you the sock. And what you're going to do is you're going to pull the sock over the sock aid, pushing it together with your hands. That's it. And you're going to pull it all the way up to the top and then make sure just take it to the wings. Now you're going to hold on to the rope, drop it down to the floor, throw it on the floor, point your toes in and pull up side to side and voila. So in conclusion, You want to make sure that you have all the pieces of equipment that we've recommended to you in the booklet that you've been provided, and you want to have this before your surgery so that you're ready to use them when it's time to go home. You want to make sure you've got your cane or your walker as previously recommended. You want to have a raised toilet seat with the arms. You want to have a tub transfer bench. If you have a tub, you want to have a long-handled reacher. You want to have a sock aid, a long-handled shoehorn.
Hi, I am Joan, one of the physiotherapists at the hospital. We will follow you while you are in the hospital to teach you an exercise program geared towards the first week of your recovery. These exercises are in your booklet, and it is recommended that you start them prior to your surgery within your tolerance to increase your muscle strength and improve your recovery. We will also practice your walking and safe transfers from various surfaces. You will be taught how to do the stairs if you have them at home. After your surgery, don't be afraid to start moving your leg right away. Moving your leg gently and frequently helps to prevent stiffness and pain and increases your circulation. Prior to your surgery, please make sure that you have a walker or crutches and a cane at home for use after your surgery. If you do not have a walker already, it is recommended that you obtain a style similar to this one.
You will be considered ready for discharge if there are no significant abnormalities with your blood work or vitals. You will need to be ambulating safely as deemed by the physiotherapist and occupational therapist. Your pain should be adequately controlled to be able to move around but not experiencing any adverse side effects. You will need to be able to eat, drink, use the washroom, and take all your medications by mouth. Most patients do very well and are discharged the day after surgery. So make sure to plan a ride for this, as your hospital stay will only be extended if medically indicated. You will be provided discharge instructions as well as receive a discharge package with written instructions that you will need to follow. Your discharge medications will be reviewed with you and any changes made to your home medications. You will receive a card for the fracture clinic where you will come for your 2-week post-operative follow-up.
Hi, I'm Dr. Leone. As a team of orthopedic surgeons here at Cambridge Memorial Hospital, we'd like to see our patients at 2 weeks after surgery and again at 6 weeks after surgery. Our 2-week appointment for the most part is to have a look at their wound, to take their staples out, and to address any questions they may have. It also gives us the opportunity to actually revisit their exercise program and ensure that they're following their exercises as we need them to.
This concludes our total joint replacement educational video that guides you through the process, healthcare team members, and point of contact along your journey. I hope you found this video beneficial and look forward to seeing you on your journey to improving your mobility and quality of life. Feel free to submit your comments after your procedure is complete and let us know if there are any improvements we can make in the delivery of care.